The difference between safe care and great care often comes down to how well you understand the body. A solid anatomy and physiology foundation helps you catch subtle changes, prioritize fast, and teach patients clearly. Now, imagine getting that edge while you commute or prep for clinicals. That is the power of an anatomy and physiology podcast. In this mini lesson, you will see how listening to an anatomy and physiology podcast boosts clinical assessment, medication safety, and escalation decisions. You will also get a quick mnemonic and a pause and practice moment to lock it in. Let's start with why anatomy and physiology drives better care. Structure plus function equals judgment. When you know how organs are built and how they work together, you can spot why something is wrong, not just what is wrong. Now let's look at 3 high-impact clinical wins from learning your A&P. First, assessment accuracy. Picture a COPD patient with an SpO2 of 90%. A podcast refresher on gas exchange and chemoreceptor drive helps you remember the safe target range of 88 to 92%, not 95. That prevents over-oxygenation and protects respiratory drive. Second, medication safety. Think about beta blockers. And the heart. A quick A&P audio review on cardiac conduction and receptor sites explains why metoprolol lowers heart rate and contractility. So you check the apical pulse, monitor for dizziness, and hold safely within parameters. Third, timely escalation. Imagine worsening leg edema, crackles, and rising weight. A brief review on fluid shifts and ventricular workload connects the dots to heart failure physiology. You recognize fluid overload and notify the provider early, preventing respiratory compromise. Here's a mnemonic to make it stick. Heart. H is for hear the concept, because short, focused podcast segments make complex topics digestible. E is for engage your brain, so visualize the anatomy as you listen. A is for apply it at the bedside, linking the physiology to a current patient. R is for recall during handoff, using precise, anatomy-based language. And T is for teach back to a peer or patient, because teaching cements learning. Pause here and choose one current patient to apply heart. Let's try a 1-minute scenario. A post-op client reports new shortness of breath. The respiratory rate is 24. The SpO2 is 92% on room air. Breaths are shallow, and the bases are diminished. Think airway and breathing first. Anatomy tells you the dependent lobes collapse first, so you encourage incentive spirometer use, reposition to high Fowlers, and reassess. The physiology link is simple. Atelectasis reduces surface area for gas exchange, so early interventions improve ventilation and prevent pneumonia. Pause the video and, in one sentence, explain to a patient why using the incentive spirometer helps their lungs. Use the words alveoli and oxygen. So why do podcasts work so well for nurses? Spaced repetition, on-the-go access, and bite-sized reviews match how busy brains learn. Short repeats before clinicals or during commutes improve long-term retention and confidence. A strong anatomy and physiology foundation turns routine tasks into precise, patient-centered care. Use the heart mnemonic, practice in real time, and keep reinforcing core systems. Keep building your confidence with flexible, expert-led learning. Explore on-demand CE and nursing education at elitelearning.com. Learn at your pace, anytime, anywhere.